The whole concept of Pacific Neuroscience Institute is to try to bring all of our high-quality physicians and caregivers under one roof.
I'm Dan Kelly. I'm the director and one of the 4 founders of Pacific Neuroscience Institute. I'm also the director of the Pituitary Disorders Center. Each of our specialists at the Pituitary Disorders Center, including the neurosurgeons, the ENT doctors, the endocrinologists, the neuro-ophthalmologists, all have an extensive track record in treating patients with pituitary disorders. We do see a lot of patients from out of the region and internationally, and we're happy to do that. We have well over 50 publications in top journals related to the treatment of pituitary disorders and related tumors such as craniopharyngiomas. We regularly participate in national and international symposia and conferences, and we're involved in fellowship training. So we're really focused on this area to give our patients the best chances for a really good outcome. One of the interesting things about the pituitary gland is it truly is the master gland in the sense that it controls all of our hormonal functions, from growth and development, sexual function, metabolism, the stress response, and water and electrolyte balance. So our biggest focus is in pituitary adenomas, which are the most common pituitary-related tumor, but there's a whole host of other more uncommon tumors and cysts that can occur in and around the pituitary gland.
Patients may be dealing with complex symptoms like weight gain, fatigue, lethargy, difficulty thinking, some external feature changes like rashes or bony changes, and they don't necessarily know what's going on until somebody puts it all together.
Sometimes it's the ophthalmologist who is seeing the individual at the first sign of a yet undiscovered pituitary problem. So such an individual has not yet been discovered to have a pituitary tumor. And then the testing that we do in the neuro-ophthalmology suite creates a suspicion that there may be a problem in the pituitary.
The missions that we have is to be able to present and try to find an explanation for all those symptoms and find the root of the problem instead of just focusing on the treatment of symptoms. We want to make sure we present all the available information to our patients so they are empowered to make informed decisions that adjust to their individual needs.
So when a patient comes in to see us, they see all the appropriate providers in one setting. They don't have to wait for various appointments. We have a discussion on the spot. We have a treatment plan that can be actionable within the next few days, and we're able to get a patient from a diagnosis to a treatment in the shortest time possible.
With technology and the advent of skill sets, we're able to minimally invasively take care of many problems in the midline of the nose, in between the eyes and the carotid arteries.
And that is the main way that we approach pituitary tumors, working through the nasal cavity with an endoscope. One of the key goals of pituitary surgery is not only to remove the tumor, but preserve or restore pituitary gland function. And we have one of the best track records and outcomes in that area. We take great time and care to meticulously preserve the gland. In the vast majority of patients, well over 95%, their gland function is preserved or in fact restored after surgery. Most of our patients after pituitary surgery go home within 1 or 2 days and are back to full activity, doing anything and everything within 3 weeks of surgery.